I came across an article by Neuroscience News discussing the benefits of red light therapy and near infrared therapy. Before I begin my discussion on the development of this new research, let's just start with what we already know about red light therapy and near infrared light therapy so that you can have a better understanding of why this type of therapy is so beneficial to our health. Red light therapy has been booming in the cosmetic and beauty industry because it's been known to improve skin tone, reduce wrinkles, reduce the appearance of scars, and it can help with skin acne as well as eczema. It's been known to help with pain relief in regards to muscle aches, joint pain, and chronic pain. It can also help with wound healing, improve your sleep quality, improve cognition, meaning you'll get better memory, as well as cognitive performance. It can stimulate hair growth, and a lot of athletes are using red light therapy to help with muscle recovery and to reduce soreness after workouts. So why does red light therapy work so well? Red light therapy increases blood flow in the body. It stimulates collagen production for all those who are looking to enhance your beauty and your skin tone. It reduces inflammation and increase cell energy production. So if you're like me, I want to know exactly how does this work on a cellular level. What does the red light therapy or near infrared light therapy do to our cells? So let's dive deeper into the understanding of red light therapy and why it is so effective. So a study in UK back in 2017, they found out red light therapy with a wavelength of 610, 630, 650, and finally 607 can be absorbed into the skin at a maximum depth of 4 to 5 millimeters. Which means that the red light therapy will be absorbed in the muscle, blood vessels, abdominal fat, lymph nodes, as well as other tissues underneath the skin. And then those near infrared lights with a wavelength of 700 to 750 did not help the body too much. So this wavelength was hardly used. And then they skipped over to the infrared wavelength of 810 to 850 nanometers. And they found that this had the most profound therapeutic effect on the human body. Now, is it more beneficial to use red light therapy between 610 to 660 nanometers? Or near infrared therapy, which is between 820 to 850 nanometers? According to the research, a combination of both of these wavelengths would be most effective for the human body. And then research studied what would happen to the human body if near infrared therapy was conducted at 1,000 nanometers or more. 1,000 nanometers was not safe for the human body because at 1,000 nanometers, usually the body begins to perceive it as heat rather than light. And the parts of the body that are most sensitive to thermal damage or heat would be the testicles and the eyes. Wavelengths in the low 800s and 600s, the two that are most beneficial to the human body, gives off just enough heat that is safe for the human body and does not cause cell damage. Most often, a wavelength in the 600s are typically used for cosmetic purposes, for those looking to get more beautiful and glowy skin. Now you're probably wondering, why would a person use near infrared light therapy in the low 800s? Again, it is to penetrate deeper in the human body, such as the bones and the nerves. Several studies have shown that wavelengths in the low 800s have benefited those who have had strokes, traumatic brain injury, as well as wound healing. The South Koreans even had a study back in 2015 that showed the use of near infrared light therapy post-recovery after plastic surgery. And they found that it reduced pain, swelling, as well as infection rates. And then a study back in 2016 with muscle recovery after a workout, near infrared increased muscle mass as well as decreased inflammation in the muscle after a hard workout. So what is the red light targeting in the body? If we think back to our old class of biology, back to the cellular level, do you remember what the mitochondria did for us? It was the powerhouse of every cell in our body. It is what gave the cell energy. And the problem lies when the body goes through emotional stress, when it goes through injury and disease, the mitochondria becomes dysfunctional. And if the mitochondria is dysfunctional, then the cell in the particular area in your body cannot do its job. It cannot use the body's raw material and turn it into energy, resulting in a deformation, malfunctioning, and in other words, damage to that part of the body where the mitochondria of the cell is not functioning at its full potential. So whenever the normal cell functioning is disrupted, it causes a ripple effect in the body, and the cells that work as a system as a whole cannot do its job. So it regenerates all of these cells so that they can work at its max potential. So now let's go back to the article that I initially talked about in the beginning of this video. A recent study by the University of Pittsburgh showed that red light therapy helped reduce inflammation in the body, reduced immune system activation, and the new finding is that it helped reduce the formation of blood clots. So why is the reduction of blood clots so important? Because blood clots are what causes heart attacks, strokes, and in our cancer patients, they have an increased rate of getting blood clots. So how did they do this? Over the span of 3 days, the University of Pittsburgh collected mice, and then they exposed the mice to 12 hours on of red light therapy and 12 hours off in a dark environment. And they tested the blood of these mice, and they found that the mice exposed to red light therapy had 5 times less risk of getting blood clots, while their activity, their sleeping, their eating habits, and body temperature all remained the same. And then they analyzed 10,000 patients who had cataract surgery, and they found that those that had blue filtering light lenses, meaning they were exposed to more red light, had lower rates of blood clots in comparison to those who had cataract surgery and used just conventional lenses. The conclusion of the study was that the red light therapy, when shown through the eyes, might be the mechanism at which it affects the blood from clotting or not clotting. Cancer patients are actually 9 times more likely to get a blood clot than non-cancer patients, which means that they are more likely to get strokes and heart attacks. So again, back to my study about the mice. The red light therapy, when applied on a blind mice, did not affect the blood clots. And then shining the red light therapy on the blood directly also did not affect the blood clots. So they concluded that the application of red light therapy into the eyes is the main activation of declotting. According to this research, this type of therapy would be inexpensive and would benefit millions of people. So the next step for these researchers is to find out exactly why it's happening inside of the human body, and to actually collect test subjects such as cancer patients who experience high levels of blood clots and exposing them to red light to determine how beneficial it is for them in the long run. But I hope you enjoyed my educational video. Make sure you like, subscribe, and check back on my next video. Stay healthy and take care, my friends of YouTube. Bye!